Hello, I'm Dr. Francis Kaklauskas. I wanted to make a supporting video for my workshop at APA. The title is Turning Contemporary Group Research and Theory into Clinical Interventions. So, group psychotherapy has been the passion of my professional career. Over the last 35 years, I've led 5 to 8 groups a week, from community mental health to university settings to forensic settings to private practice. I'm sure there is some form of group that I haven't found myself in the leadership role of, but I feel like I've done many different groups, from social skills groups to DBT to psychoanalytic understanding one's unconscious, existential groups, a variety of relational psychoanalytic approaches to cognitive behavioral groups for relapse prevention, or mindfulness groups for increasing self-acceptance and parasuicidal behavior. So in thinking about all these experiences, it's rare to find something that will work for every type of group. But I came up with a structure for this workshop that I'm hoping will be helpful to you all as you continue doing groups or as you embark on this very exciting activity of becoming a group leader. So I broke this down into 4 options you have as a leader. One is group as a whole interventions, one is dyadic or subgroup interventions, one is individual interventions, and the last is silence and presence. So let me say a few things about each of these and their subcategories, and you can follow along on the handout that's attached. So I think we need to reinforce the structure of a group. This would be group as a whole. So when do we meet? How often do we meet? What are the fees? I call these group agreements, which seems to suggest that there is some give and take between the leader and the group members. But at the end of the day, you are in charge, unless an agency or an embedding organization above you is in charge. But is there a way that this can be collaborative? Some schools of group use the idea of contract, and I moved away from that given contract and its views in Western intellectual tradition of human nature being much more kind of negative and self-serving, which I hope not to believe. So we're going over the group agreements. The group meets Monday at 5 o'clock for 80 minutes, and the fee is a $5 copay, or you work out the fee with the accounting office of the agency. But having these details worked out kind of brings some kind of certainty and security to what's going on within the group. So the next part of the agreements I like to cover is, what is the expected member's behavior? These might include showing up on time, staying for the whole time, informing the leader if you have to miss or have to come late or leave early in some way. What I ask group members to do is to give some effort and try to bring some alertness to group. Being in group can be a very anxious situation. Oftentimes you're there with people that you do not know. Oftentimes a group member's worst fears of what has happened to them in previous groups that has been injurious or not helpful may be coming up. And hopefully, and you can prime the group for this, you could also ask the group for what experiences in groups have been helpful or beneficial for them. What behaviors were present in that group? Could we try to aspire to similar types of interactions in this group? So I really put a strong emphasis that there'll be no abusive behaviors in the group. We won't be calling people's names. We won't be screaming at each other, threatening violence. Given my history, say particularly in forensic and doing lots of groups with parolees or in jail, that having this be very clear that what is allowed and what's not allowed in group. And then you may have some form of having the person leave the group, asking them to leave, talking to them outside the group about their behavior. And when this happens, of course, you'll have to intervene in some way. Maybe I'll save some stories towards the end that reflect some of these. The next expected member behavior is that we will address microaggressions. So sometimes microaggressions, it's very hard to know if it's unconscious or purposeful. I'll do my best in my training and my experience to point these out. I also ask for the support of the group members, that if something has happened that could be degrading to someone's identity or put down or excluding someone from the group, that we bring this up, we talk about it. Sometimes people can say ouch, and we can explore why this is hurtful. We can reinforce the idea that we try to avoid microaggressions in the group. If microaggressions happen, we address the microaggressions in group. Many wonderful paradigms for this. I particularly think of Aziza Belcher-Platt, who discusses first working with the person who was microaggressed against, and then working with the person who did it. In my view, ideally, we try to heal that rupture, and we try to keep everyone in group in some way, and that this is an opportunity for everyone to grow so we can have a better community within the group and beyond the group. So that's the basic group agreements. The next section I outlined is expected outcomes and processes for achieving these outcomes. So this may include topics such as, similar to the agreement, productively sharing the talking time, which may be talking about what the topic of the group is, potentially sharing one's own experiences, sharing one's ideas, sharing one's thoughts. And this would be different than, say, coffee talk of good TV series, although we're always titrating the intensity in a group depending on our members and how hard the group's been working. And sometimes taking such breaks can be helpful or even beneficial. But the expectation is that the whole group isn't coffee talk in some way. I ask members to be open and honest in the group, but also that they're responsible for what they say in some way. So groups work best when people can talk about their challenges, their past, their hopes for the future in some way, their reactions to one another. So this is part of the process. If we want to achieve an outcome, say it's social anxiety, and this will be different in each group, the expected behaviors may be different in each group. Say we're thinking of a mindfulness CBT relapse prevention group, we may have homework, and the expectation will be for people to kind of do their homework, do it honestly, share about the homework in some way. For people to be alert, and for people to have some level of vulnerability and also some resilience in the group. This will help us achieve the outcomes. Now, I think it's important not to promise in terms of the outcomes. Say in a social anxiety group, perhaps by being in this group, you'll be better able to meet the challenges of your life circumstances or take risks towards going after the things that you may like in your life. And it will probably not be a cure that you will never feel socially anxious. You'll never feel potentially judged by others. And the other example I gave of mindfulness relapse prevention group, we might ask people to talk about their previous use, their cravings, their coping skills when they have cravings, what has worked, what hasn't worked in some way. Moving this on to, say, a more personal growth, psychoanalytic process group, the expectations would you may get more clarity about yourself, you may get more clarity about your interpersonal style, about your communication skills. And the way we get there is by sharing your reactions to one another, being honest with your reactions, trying to talk about why you're having the reactions you're having. Is this a historical, personal reason? Is this potentially some kind of socio-cultural edict that was passed down to you in some way? And with the hope, say in this process group, that people may be able to have better relationships, may be able to gain more comfort with themselves. So going through these group as a whole dynamics, we talked a little bit about the group agreements, a little bit about the expected outcomes and the process for achieving these outcomes. And then the last is group dynamics. So you can address what may be happening in the group. It seems like the group is full of reminiscent tonight. Everyone is telling stories. You're not judging it in some way. You're bringing awareness to the dynamics that can help people when they get caught up in the wave of a social dynamic, or potentially highlight something that may be important that the group's not discussing. You can discuss what you might think as the underlying feelings in group. You could ask a group, what are people feeling tonight? There may have been a very significant event in our socio-cultural world that people may need to talk about in some way. You may need to somehow bring up the unspoken. I think for years I did court-ordered groups, and often the group would bring it up, but people don't want to be in this group. People have very little expectations that this group could be helpful. People have lots of uncertainties about myself and my intentions in this group. Or there may be a racial or gender dynamic in going in group, and can we talk about that? Can we bring out the unspoken? It seems like it's mainly the white men who have been speaking. How about if we try to have this be a place for everyone to speak? So you can observe what's going on and not only pay attention to what is happening, but what potentially isn't happening. And then you can risk speaking this unspoken. And the group will usually clarify for you your accuracy, your inaccuracies. In some way they may refine it, in some way there may be some defensiveness, but often these unspoken dynamics are an interference to progress in the group in some way. So I put this topic of group as a whole interventions because I feel like it may be the most important, and it may be the most challenging for newer group leaders to learn and to practice, and it may come with some awkwardness when you initially use these types of interventions in some way. So the second level of intervention I want to highlight is these dyadic or subgroup interventions. So someone may speak or share a story. I might ask another member, what stood out in this story? How was it to hear this story in some ways? Does this story bring up any memories for you? Did this story bring up any feeling states within you? So you can kind of, as Lou Ormont spoke about, orchestrate a group. You might ask someone in group to talk to a member that may have similar experiences to build cohesion, to build safety, to build support in some way. And simultaneously, you might ask someone who may have a different point of view. So say we're talking about substance abuse, and people are sharing their stories of their struggles with sobriety and the harm that it caused, and their wish for people to just kind of move on and rebuild trust in a quicker time frame than is happening in their relational sphere. So potentially you could ask a group member who has a different view that could maybe talk for a subgroup or talk to that subgroup who is talking just about wanting to move on. You might, in this example, you might ask someone who's had a parent or a partner or someone close in their life with a substance use problem, and how their experiences with rebuilding trust, or their experience in this Bardo state between beginning recovery and sustained recovery in some way. Sometimes I'll ask people to either identify which subgroup they're in or even name people in various subgroups. I might ask people, who in here is ready to talk about the topic today, or who in here might be ready to share about their experience practicing the skills last week, right? And who in here feels like they might need to have a week off, sit back, be more of a listener in some way. And ideally, you might have those groups talk a little bit with each other. Oftentimes, the people who are most quiet get the most projections, and if they can say a little bit about why they're being quiet, it can create a lot more sense of safety in the group. Often, quiet members are projected on as being very judgmental or being very negative towards what's happening in the group in some way. And these subgroups can be around level of how hard one wants to work, how much one relates with an experience. It can be around identity or a variety of intersectional identities. In some way, these groups might be around age. So the idea is ideally that somehow you create this cohesion where people feel like they are a team working together for everyone's benefit, but without realizing that there are different groups and people are feeling akin to different people in the group in different way. A wonderful idea that came out of system-centered therapy that you could consider is there a way that over time you could have each member of your group, at least in one way, if not in many ways, identify with each other member in the group in some way? So in group, there's a lot of pressure to conform, and bringing up these subgroups can kind of get us out of our automaton behaviors of acting like the subgroup leader would like you to act, or what might be the norms of social interactions, and kind of see what's happening under the surface and really expand whatever topic it is that there's multiple views that are happening within the group. And in my personal view, I think it's excellent and very important to gain support and see similarities in group. This sustains us for doing the work of being in group, helps us have a sense of belonging, but really the growth comes when we discover something new. People have a different perspective, a different experiences, expands us as group leaders, but also expands the members in some way. So the third level of intervention I want to talk about is individual intervention. Many of us do both individual therapy and group therapy, and most of us have much more experience with individual therapy, and we have many of these interventions that we can draw upon. So sometimes these are helpful. If possible, I would really work on developing your group as a whole in dyadic or subgroup interventions. But what would be some individual interventions? I might ask someone who's saying something, could you share more? Could you share more details? We each develop our own style. I have a playful style I developed over the years. I might say something like, could you be more vague? Or I might give a hand gesture like, and, or I might even pull out my ear and look at a member to see if they'll talk more in some way. And so after a member talked, while we can go to another member for their response, we might also want to ask them, how is it to share this information? Right? What was the responses? What were the expected responses? We can build on that and maybe ask them after a very personal or vulnerable share, is there someone in the group that they would like to hear from next in some way? So giving them some autonomy, some power to direct the group in what they would like to have happen. At times, you may need to direct a member towards a specific behavior. If you have someone who is dominating the group, you may have to find an intervention to be like, Chris, you've said a lot so far tonight. I would like you to sit back and listen, and I want to check back in with you around what stood out with that in some way. Or I have seen members make very unconscious behaviors of threatening or making fists in some way, and we might need to say that I've noticed you're making two fists. I wonder if that could be scary for others. You could say, what's going on for you? Is this in response to what's happening in the group? Is this an old habit? Would you be willing not to do this in some way? Right? You might ask a member who has been quiet, I've noticed you've been quiet. Is there anything that stood out to you? Anything you'd like to say now? Or I'd like to come back to you in a little bit of time and give you an opportunity to talk in some way. Of course, there's more extreme examples where you have to tell a member to leave group if they're intoxicated in group in some way. But there's many options. I might ask people, say, who have a very intellectualized defense, listen to what's happening in group and notice if there's any feelings that come up in you, or maybe you could pay attention to what you think the other people may be feeling in some way. Ideally, as each member has different goals for the group, their path for achieving these goals may be slightly different, and you can really develop collaboratively with the member what might be most helpful for them to practice, for them to do in vivo experience of the group. We talked about a social anxiety group. People might go around beginning the group, starting the group first to deal with this specific anxiety in some way. We may ask a group member to notice when they're having a specific memory or potentially when they're getting triggered or agitated, and could they talk about that, or could they let me know in a way to try to tolerate the intensity of the group, to make sure they feel like they have an ally in the group and to sustain the challenging work, which is being a group member. So the last intervention strategy I want to talk about is silence. There's an old group adage that a leader never breaks a silence. So I've been in many groups as a member and have sat through 10 minutes of the group being silent. I don't prescribe so rigidly to that rule, because sometimes a group needs help, needs encouragement, needs guidance to figure out how to participate in some way. However, I do oftentimes try to take a breath or 3 or 5 after someone spoke. As a leader, over the years, I'm constantly tracking my thoughts. I'm tracking how this fits into different structural understandings of whatever the member's challenges in some way. I'm tracking my own memories, my own countertransference, things like projective identification, if that may be happening. And while I may want to speak to this, so much of the work of a group leader, and really of any type of therapist, and this goes back to Winnicott, is containing strong feelings, confusion, it might be happening, awkwardness, anxiety. Is there a way that we can hold and contain these things and maybe not jump in immediately if the situation doesn't require it, such as in an abusive situation between group members? And oftentimes I have found that whatever I'm thinking, if I can be patient, other members will be able to speak to that, maybe in language that isn't so filled with psychobabble that the other members may hear. Or someone may finish and I have an idea of what I'd like to say, where I'd like to take the group, but a group member speaks up with a different idea and other group members respond to that. So really, by being silent, you're really co-creating what can be happening in the group. Sometimes I don't know what to say. So if I practice being silent when I have ideas of what to say. It won't come so shocking to the group members if I sit in silence. So there's another side of silence, which is I think you want to bring presence that has been found difficult to define but found helpful in the group research, whether that's sitting up straight, looking at members, looking around, having open or alert body posture in some way. So you're not sitting there necessarily checked out or bored. Of course, all these rules have exceptions, and I have great respect for Dr. Elizabeth Olson, and when the group was doing small talk, I remember some interventions of like looking at a watch or looking bored in some way. But even those are bringing a lot of presence. That being a group leader is really a mindfulness practice of how can we come back to the present moment, come back to ourselves, come back to the people in the room. And this is a skill I think that develops over time in some way. So to summarize, we're talking about group as a whole interventions. I said I might give some examples. Some examples I've given is with groups when they're being resistant. I've said things like, should I feel so hopeless for everyone in this group? Or it sounds like everyone in this group, pardon my language, is friggin' miserable. Or I might say that it seems like this silence is really a deep reflective silence, and we can have this silence continue till we know what to say. Or I might say that it feels like there's tears about to come out in this group. Is it okay to have tears come? Or I might even give a command intervention or invitation. It's okay to have tears come in some way. So endless possibilities of group as a whole interventions. Sometimes when a group is off task, I might bring it back, as I said earlier, to the group agreement and the structure. Remind me, I think we are all here to work on our social anxiety or to understand ourselves better or to look at our communication skills. I think our agreements were that we would try to be honest and open and share the talking time. Can we do that? Or what's the obstacles to doing that in some way? So coming back to the structure, the agreements of the group, right? It seems like we'd all like to get better, and it seems like there's been a pattern of less people doing their homework in the group. How should I understand that? I might suggest possible answers at times. Is it because the homework's really terrible in some way? You could just let me know that the homework isn't good homework in some way. So many possibilities of addressing the group. Now, the downside of addressing a group is kind of in social psychology, the diffusion of responsibility. So when you address a group, oftentimes people may not respond. So sometimes I might follow up with a group as a whole query of, it seems like we're talking mainly about TV shows today. How should I understand this? Or are we avoiding talking about more challenging topics? And then they'll be silent in the group. And then if there's someone who I feel has the courage, who won't get scapegoated in the group, I might ask them, Chris, have you noticed this also? Potentially when you're in groups, right? I'm a deep believer in training, and early in one's career, one trains really hard, I think, and all the time. So I can imagine when I've been in family groups or work groups in some way where I'm thinking about group as a whole interventions I might do. If I'm not the leader, what's being unspoken? Are we replicating some socio-cultural norm? of giving just empty platitudes to one another, or are we just avoiding any forms of gratitude or appreciation for one another in some way? I might notice, say in a work group or family group, that people have a longing for deeper connection, right? And then as a person, as a member of a group, either some kind of work group, a therapy group, or just in your social groups, you can develop your group skills to help all the groups in your life potentially be more productive, more meaningful. In this example I gave of small talk happening, perhaps an intervention, I would share something vulnerable about myself, or I might check in like, oh, how did your doctor's appointment go, Chris? Or something like that. So it's something you could potentially play with sometimes, or even if you're watching some form of mass media, what might you say to that group that's on the screen in some way? This takes time, so have fun with it and enjoy the process of becoming a group leader. We're never master it, and even who we are is constantly changing as our culture changes, as we change as people in some way. So dyadic or subgroup interventions, this is a little provocative. When I was doing forensic groups, I might give an example of 50% of people who are here because of a conviction of a violent offense will get a second conviction for a violent offense. Look around the room, and who do you think will be in that 50%? And do you think you'll be in that 50%? And why or why not for others, and why or why not for you in some way? Right? You can talk about maybe subgroups in group. That it seems like some people here have a comorbid struggle with both anxiety, depression, bipolar illness, and a substance use issue, and some people don't. So there'd be a question of whether we could learn from each other, or people feel like they just need to learn from people whose experiences are most similar, which is not something I agree with, but something you can explore when there's a roadblock. Of course, there's this old analytic adage that training analyst goes to their supervisor and says, what should I do in this case or that case? And all the analyst ever says, the supervising analyst ever says, is explore. They bring up another situation. They say, oh, explore. Now we can have to make a decision as a group leader of when this exploration is actually preventing us from getting the work done of the group, where I've been in groups that have explored, say, whether we pull the shades or not. And this can be very important with people feeling power, feeling like they have a voice, feeling like they can ask for what they want in some way. And then it can also be a way of just avoiding other work of the group in some way. And oftentimes we have to make a decision and take a stand as a leader, and people will give us feedback, and we consider the feedback. And part of the work of group for the members, and maybe for the leader, is to kind of realize the imperfections, the foible of human relationships in some way. I'm getting a phone call. And to somehow learn that groups have good moments and stagnant moments and hard moments and painful moments. And this goes back to, object relations, that people have good qualities and limiting qualities. And in terms of group, realistic expectations will never meet all the group members' idealization or hope for the group. They'll inevitably walk away from this group with some of what Lacan might call lack of a still desire for more growth in some way. But that doesn't mean it hasn't been a good group, in some way. If I'm going to try to give a few more individual group interventions. I might ask, is there more to say about what you said, or more that you say about last week? Or how has it been that I asked you to be quiet and observed in some way? Whenever you have, this is my suggestion, whenever you have an impulse for an individual intervention, if possible, can you practice silence and see if there's a way that you can accomplish the same thing, either by a dyadic or subgroup intervention, or group as a whole intervention. So in this example of someone having a medical check, I might ask another member, Chris, do you think I'm the only one who's worried about how Pat's doctor's appointment went last week? Right? Is there a way to take your individual question that you want to ask of a member, that you might ask that of another member? Now you have a choice in who you ask, of whether that would be supportive or whether that could be challenging in some way. So you could ask, if you want to ask Chris what it was like to share, you could ask someone who relates with Chris, Pat, how do you think it was that Chris just shared this in some way? So, of course, we need to use individual interventions. You need to provide support, people to feel understood, but if there's a way for people to explore more deeply, but if there's a way to bring others involved, that's the ideal way in some way. And then over time, you are training a group of how to be with one another, but they're also training you, I think, of how you can be most helpful for them. And this might be more activity in some groups, particularly in the early stages of group. It says a group leader should be more active, is generally helpful, and they'll hopefully let you know. And a very important skill, which was my mentor, Dr. Robert Unger's dissertation, is not being defensive as a group leader. So they might give you feedback on how you're leading the group, and this might be helpful, it might be some projective or transference based in some way. But generally, when you get defensive, you kind of shut down the exploration. If someone says, Francis, you haven't said anything, you might say, oh yes, I'm glad you noticed. Would people like me to say more? Right? How is there a way that you can take something that you could feel as an attack and open it up for a group discussion in some way? And my own style is to be, while I can be very harsh and provocative and set limits, is kind of be more gentle. So sometimes when a member is just being disruptive, you might need to tell them to stop or ask them to leave the group. But is there a way that you could, when someone says they'd like you to talk more, I was thinking that myself. What kind of things do you think I should say? You could say that the member or the group should say in some way. And then sometimes you'll make an intervention and they'll say it was a bad intervention. But more often than not, the group has a will of its own beyond talked about group moving towards knowing something, and they may move towards trying to understand something that's alive for the group in some way. And the paradox of this would be potentially group is also a place where people will unlearn, unknow. And when there is a rigid perspective, perhaps you can mine for more detail or depth or exceptions to these rules, as you might do in some of these cognitive behavioral interventions. So silence, sometimes at the beginning of group, sometimes I'll say, these are the things on my mind. I usually think a lot about my groups in between their meetings, and I'll have a list of potential things I want to say to the group, or topics, or things I want to ask individual members or subgroups in some way. often when I am more patient, that these will come out anyway. I think some of the ways that I get mocked for when I start a group, I'll be like, what do we have? Let's begin in some way. And then one last thought about silence is sometimes something profound or important or even aggressive or traumatic has happened in group, and we can be frozen in silence or wanting to freeze, or is there a way that we can practice at least saying something in those moments when need be, even if it's the wrong thing, that oftentimes it moves things along. I think of this particularly as important when either a member or a subgroup is going into deep shame or down a shame spiral in some way. Is there something you can say to add more language? And then what happened, or what's next, or what are people feeling at this moment, or I feel like I'm not being effective. It doesn't matter what you say. While we want to practice silence, we also want to practice getting into the space. Early in my career, I had a severe stuttering problem throughout my life, which has gotten better, I think, through a variety of experiences, including just more clinical experience and personal therapeutic work in some way. I would have to practice when I drove in or walked over into a room, trying to say things, as the examples they say. Pat, what do you think of what Chris said? Do people have other things to say? Or is there anything left over from last week? I would have to practice that, and sometimes, do a little hand motion as that would help me get the words out in some way. So this will be my closing thought. As group leaders, we all have unique individual strengths. Some of us are gifted relationally. Some of us have very sensitive hearts and can notice when people are feeling excluded or vulnerable. Some of us are very knowledgeable. Some of us are wonderful teachers or explaining of things. So recognize the skills you're bringing to group in some way. And then potentially through supervision, through sharing your work with other group therapists, stay open to new ways in areas of growth in some way. And good enough, right, to end on Winnicott again, right? Can we be good enough? The research overwhelmingly suggests that groups are very effective for a variety of specific theoretical and manualized treatments, as well as for a variety of semi-universal process factors in some way. Really, the research seems to suggest only when there is a very challenging group experience, a challenging group member, that's when therapists can struggle. But that's why we have supervisors and mentors and literature that perhaps at the end of group, you could say to yourself, what did I do well, or what went well, prior to exploring what may have been different. So thank you for listening to all this. I hope this gives you some ideas of things you could say or do in group leadership. And I wish you the very best in your careers and leading groups, and enjoy the ride the best you can. Bye-bye.